Okay, so these are my blank cheat sheets. Okay, and then my blood pressure cuff. My supplies. And then my alcohol wipes. Okay, so now I'm going to go ahead and start my assessment. So,
Hello.
hi, Kylie. I'm going to be your student nurse today. Can you tell me your name and date of birth, please?
Jim Corral, 1927-2000.
Okay, and do you have any allergies to food, latex, environment, or medications?
No.
No. Okay, so I'm going to provide patient privacy. Onto the bed. Can I just verify this on your wristband? Okay, everything looks good. Do you have any allergies that I should know about at all, such as medications, food, environment, or latex?
No.
No? Okay, so I'm going to go ahead and ask you a couple questions. So how old are you?
I'm 20.
You're 20, okay, and are you married?
No.
No? Okay, and do you have a job?
Yes.
Yes, where do you work?
At a dealership.
At a dealership, okay. So I'm going to ask you a couple questions. So what brings you in today?
My head really hurts.
Your head really hurts?
Yes.
So were you doing anything to make it hurt, or it just kind of came on?
Started at work.
It started at work? Someone making you mad?
No.
No? Okay. So I'm going to ask you a couple questions. So how bad is your pain? On a scale of 0 to 10, 0 being no pain and 10 being the worst pain you could imagine, what would you rate your pain at?
3.
A 3? Okay, and does it radiate, like to your neck or anything?
No.
No. Is it constant? Does it come and go?
It's constant.
It's constant? Okay.
Yes.
Is there anything that makes it better, such as medications?
No.
No. Whoa. Okay, and is there anything that makes it worse?
Light.
Light makes it worse, okay. And does it prohibit you from doing anything in your daily life?
No.
No. Okay, and what part of your head does it hurt?
Just like all my head.
Okay. So, what about your past history? Have you ever had measles, mumps, or chickenpox?
No.
No. Are you up to date on your immunizations?
Yes.
Yes. When was your last flu shot?
Last year in November.
Last year in November, okay. And I already asked you about your allergies. So, do you have a family history of high blood pressure, diabetes, or cancer?
Yes, my mom has high blood pressure.
High blood pressure, okay. And how old is she?
She's 43.
She's 43, okay. And does she have any other underlying conditions?
No.
No, okay. And how about your dad? Is he alive?
Yes.
Yes. Does he have any underlying conditions?
No.
No, okay. And how old is he?
He's 49.
49, okay. And do you have any siblings?
Yes.
Do they have any underlying conditions?
No.
No? Okay. I'm going to move on to a functional assessment. So, what about any self-care behaviors? Do you partake in any, like meditation, yoga, exercise?
Yes, I go to the gym every morning.
The gym every morning? Okay.
Yes.
And how is your financial status? Is it adequate for your daily life?
Yes.
Yes, okay. And what is the last level of education you completed?
College.
College, okay. And do you have any religious practices that I should know about?
No.
No, okay. And how about in your daily life? Are you continent? Can you feed yourself, bathe yourself, dress yourself, transfer yourself?
Yes.
Yes, okay. And you're ambulatory. Okay, so I would say that my patient does not have any need for assistance for anything in his daily life. So how is your sleep and rest patterns?
Good. Sleep between 7 to 8 hours a day.
Okay, and do you ever take any naps?
I do.
You do? How often?
Like once a week.
Once a week, okay. And how about any substances? Do you use anything like alcohol, nicotine, any illicit drugs?
No, alcohol.
Just alcohol,
Yeah.
okay. And how many days a week would you say you have a drink?
The weekends.
The weekends, okay.
Yes.
And how many drinks would you say you have on the weekends?
Like 6.
Like 6, okay. So if indicated as it is, I would perform a cage assessment. So do you ever feel like you should cut down on your drinking?
No.
Do you ever feel annoyed by what people say about your drinking?
No.
Do you ever feel guilty about your drinking?
No.
Do you ever use alcohol as like an eye opener to get you going for the day?
No.
No? Okay. So I'm going to ask you a couple questions, and they are personal, so feel free to let me know if you feel uncomfortable at any time, okay?
Okay.
So in the last 2 weeks, have you felt down, depressed, or hopeless?
No.
No? Okay. And in the last 2 weeks, have you felt little motivation in doing things?
No.
No? Okay. So if indicated, I would do a PHQ-9 screening, where I would ask the patient, do you ever feel like life is not worth living?
No.
No? Do you ever feel like you should hurt yourself?
No.
No? Okay. So again, these are personal questions. So in the last 2 weeks, never mind. So I'm going to ask you about some questions about domestic violence. So because domestic violence is so common in our society, we're asking all of our patients a series of these questions.
Okay.
So do you feel safe at home?
Yes.
Okay. And does your partner ever hit, kick, punch, or anything?
No.
No? Okay. So if indicated, I would perform a danger assessment. So now I'm going to move on to mental status. So the posture is erect, the movements have been smooth, the patient's dress, groom, and hygiene are appropriate for occasion and weather. The patient's speech has been clear. I do not know any slurring. It's been appropriate for the conversation. Can you tell me where we are?
Hobbs, New Mexico.
Okay, and can you tell me about what time it is?
It's 6:30 in the morning.
Okay, and what about the date?
Today is March the 12th of 2021.
Yes. Okay, so patient is oriented to time, place, and person. The patient does not have any suicidal ideation. And I'm going to ask you a couple questions about your memory. So who is the current president?
Joe Biden.
Okay, and who is the first president of the United States?
George Washington.
George Washington. Okay, so my patient's memory, remote, and recent are intact. So I'm going to go ahead and move on to a head to toe assessment, okay?
Okay.
Okay, so I'm just going to perform hand hygiene. So I will be touching your head and stuff, so if you feel uncomfortable or any pain or anything, please let me know, okay?
Okay.
Okay, so do you have any bumps or lesions on your head that I should know about?
No.
No? Okay, so I'm going to go ahead and touch your head. Okay, the head is normal-cephalic. I do not know any elevations, bumps, lesions, or depressions. The nasal labial folds are symmetrical. The patient's creases have been symmetrical when the patient talks. The head is in the midline of the body. I'm going to go ahead and assess your range of motion.
Okay.
So can you look down to the floor? Okay, and can you look up at the ceiling? Can you look left and right? Okay, and can you bring your ears down to your shoulders? Do you feel any pain when doing that?
No.
Okay, so no crepitus was noted. I'm going to go ahead and move on to my patient's face. So the eyebrows are evenly distributed. The patient has been able to blink. And for Glasgow Coma scale, the best response would be a 5. The eyelashes are evenly distributed. The sclera is white. I'm going to go ahead and assess your eyes, okay?
Okay.
Okay, the conjunctiva is pink, and I do not know any lesions. I do not know exophthalmos, which is when the eyes protrude out, or anophthalmos, which is when they are sunken in. The nose is in the midline of the body. Do you mind closing your eyes and occluding one of your nostrils? Okay, and just let me know you can smell this, okay?
Okay. I can smell it.
Okay, and can you switch sides?
I can smell it.
Okay. So the patient's smell is intact. I'm going to go ahead and move on to your mouth, okay? So
Okay.
can I go ahead and get you to open your mouth for me? Okay, and can you say ah? Okay, so the patient's motor responses are intact. The teeth appear to all be evenly distributed. I do not know any redness of the gums. The lips appear to be pink and moist, and the tongue was pink and moist as well. Okay, so now I'm gonna move on to the ears. Okay, so I'm just gonna feel on your ears. Do you feel any pain when I do any of this?
No.
No. Okay. What about when I do these?
No.
No. What about this?
No.
When I mess with this?
No.
No. And do you feel any pain back here?
No.
No. Okay. So the patient's ear skin is intact. There's no tenderness, redness, lesions, bumps, or anything present. The patient has been able to hold a conversation with me, but I'm going to go ahead and further assess your hearing, okay? So if you could just sit right there and raise your hand on the side you can hear me on, okay?
Okay.
Okay, so my patient's hearing is intact. Now I'm going to move on to a skin assessment, okay? Oh, before I do, I'm going to go ahead and examine your external meatus. Okay, so it is appropriate for the ear. I do not know any drainage. If there was drainage, I would note the color and the texture of it. Okay, so now I'm going to move on to your skin assessment. So, before doing so, I would like to state that my patient's hair is evenly distributed and was soft to the touch. Okay, so I'm going to be assessing your skin. So do you have any bumps or lesions that you want me to know about beforehand?
No.
No? Okay, so I'm going to go ahead and assess your temperature. Okay, the patient is warm to the touch, not overly diaphoretic or cold, which could indicate hyperthermia, hypothermia. The patient's pigmentation is evenly distributed. I do not see any lesions or wounds or anywhere. If I did for wounds, I would document the location, size, and the exudate, which is the color and the odor. For the lesions, I would document if it was asymmetrical, if it had a border, the color of it, the diameter, if it was more than 6 millimeters, and if there was any elevations, okay? So I'm gonna go ahead and assess your skin for any tenderness. So do you feel any pain when I do this?
No.
No? Okay, and I'm gonna go ahead and assess for edema. Okay, so edema is not present. If edema was present, a 1+ is mild, a 2+ is moderate, a 3+ is deep, and a 4+ is very deep. I'm going to go ahead and move on to your legs, and I would do the same assessment, looking at the pigmentation, the temperature, if there was any wounds or lesions. I'm going to go ahead and assess for tenderness. Do you feel any tenderness when I do any of this?
No.
No? Okay. And I'm going to go ahead and assess for edema. Okay, so edema is not present. If it was, I would use the same scale. Okay, so can I see your hands? Okay, the nails appear to be smooth, or they're not jagged or bitten to the quick. I'm going to assess your capillary refill. Okay, it was less than 3 seconds. I'm going to go ahead and assess your motor, your response to pain stimuli. So tell me when you feel pain, okay?
Okay. There.
Right there. Okay, so on the Glasgow scale, I would rate that as a 4, and putting us at 9 currently. Okay.
Okay.
And then the speech has been clear, so I would rate that as a 6, and the patient has a 15, which indicates that they are oriented and are fully aware. Okay.
Okay.
So now I'm going to move on to some vitals. Okay.
Okay.
So I'm just gonna go ahead and get this pillow ready so that we can start your blood pressure, okay? So while we are doing your blood pressure, I'll be doing other vitals, okay?
Okay.
So have you had any recent surgeries on this arm, or any IV picks or anything recently placed?
No.
No? Okay. So I'm gonna go ahead and assess blood pressure on this arm. Okay, relax. Thank you. Okay, so I stopped feeling it at about 100. So I'm gonna go ahead and give your arm a rest for a minute, okay? Can
Okay.
I use this arm and I'm gonna assess your pulse and your respirations, okay?
Okay.
Okay, so my patient's pulse was 68, which is normal. It should be anywhere between 60 to 100. Your respirations were 14, which is also good. Your respiration should be between 12 to 20. So if I had a pulse ox, I would place it on my patient's finger and make sure that their oxygen saturation was between the normal limits, which is 95 to 100%. And then if I had a thermometer, I would assess their temperature, and I could do it tympanically, orally, rectally, and so on. And I would make sure this within normal limits, which is between 96.8 to 100.4. Okay?
Okay.
So I'm just gonna go ahead and finish your blood pressure, okay?
Okay.
Okay, so I got 122 over 86, so that's really good. That is just slightly elevated, but it is still not too high. If it was more than 20 over the normal is less than 120 over 80. So if it was more than 20 over the normal, then I would go ahead and tell the doctor, but it's okay, okay?
Okay.
So do you have any other pain today?
No.
No? Okay. So now I'm just going to move on to some other assessments. So we're going to start with perfusion. So I'm going to ask you to lay down for a second. Okay. And can you look towards that wall? Okay. And can you look back this way? Okay. I do not know any jugular vein distension. Can you go ahead and sit up for me? Okay. I'm just going to assess your carotid. Okay, so I'm going to go ahead and auscultate your carotid, okay?
Okay.
And I'm going to clean it like alcohol wipe. Oh, can you take a deep breath in, out, and then hold it?
Yes.
Okay, again. Okay, again. Okay, and I'm going to switch sides and I'm going to ask you to do the same thing, okay?
Okay.
Again. Once more. everything sounds good. It was even throughout. I'm gonna go ahead and auscultate your heart sound, okay?
Okay.
Okay, so this is your aortic.
Okay.
Okay. This is your pulmonic. Curves forward. Tricuspid. And then mitral or apical. Okay, so it all sounded good. I noted that it was in a good rhythm and it did not appear to be skipping beats or speeding up at any times. Okay, so now I'm going to go ahead and assess all of your pulses and make sure that they are even. Okay, can I go ahead and start with your arms? Okay, so they are normal. So if they were absent, that would be a 0. A 1 plus is weak and tready. 2 plus is normal, and a 3 plus is full and bounding. Okay, I'm gonna go ahead and assess your wrist. Okay, it's also normal. I'm gonna assess your ulnar. Okay, so your radial and ulnar were both a 2 plus, which is good. That's the normal. I would assess the femoral, but that is not necessary right now. Can you put your legs straight, please? Okay, so I'm gonna assess your popliteal. Okay, that was a 2 plus as well. I'm gonna assess your dorsal pedis. Okay, and then your posterior tibialis. Okay, so those were both normal. The rate has been normal, and everything appears to be symmetrical throughout. So now I'm going to go on and move on to gas exchange. So can you stand up for me? I'm going to go ahead and assess your diameter, so please stay right there. Okay, so you have a 1 to 2 diameter. If you had a 1 to 1 diameter, that would indicate barochest, which could be associated with respiratory disorders. If you had pectoris excavatum, that is when the sternum is sunken in, and then incarnatum is when there's pigeon chest and the sternum is protruding out. Okay, so I'm going to ask you to turn around for me for a second. Thank you. So can you take a big deep breath for me? Good job. Okay, so it bilaterally opened and recoiled back. I'm going to go ahead and assess for tactile firmitis. So every time you feel my hands move, can you say 99?
99, 99, 99, 99, 99, 99.
Okay, and I'm going to go ahead and auscultate your blunt sounds for the posterior. Okay?
Okay.
So every time you feel me move my stethoscope, can you take a breath in and out, please?
Yes.
Okay. You feeling okay?
Yes.
Okay, so everything appears to be okay. I did not hear any adventitious lung sounds, such as crackles or wheezing or anything, so everything sounds good. You can go ahead and sit down for me. I'm gonna go ahead and auscultate the anteriorly. Do you feel okay?
Yes.
Yes, you don't feel lightheaded or anything?
No.
No? Okay. I'm gonna go ahead and do it again, okay?
Okay.
And if you could do the same thing for me.
Okay.
Okay, so they sound the same anteriorly. I do not know any adventation sounds, such as crackles or wheezes. Okay.
Okay.
So I'm gonna go ahead and move on to elimination. Okay. So when was your last bowel movement?
This morning.
This morning. Okay. And can you describe it for me?
Brown.
I'm sorry, that's awkward, but still. And can you describe like the texture of it? Like, was it hard or more on the liquid side?
In the middle.
It's in the middle. Okay, so I would rate it about a 3 for being around normal. So now I'm going to ask you to lay down for me. Okay, and I'm going to be assessing your bowel sounds and everything. But first, I would like to. Oh wait, let's see. I can't get him see. The patient is. I would look for any venous patterns, striae, the color of the abdomen, and then the contour of it, such as if it was scaphoid, it would be sunken in. Protuberant, which is when it's slightly rounded. And then I'm gonna go ahead and I'm going to, can you move your arms? Thank you. I would break up your abdomen into 4 quadrants from your belly button horizontally and vertically. So in the right upper quadrant, it is the liver, the right lower quadrant is the appendix, the left upper quadrant is the stomach, and the left lower quadrant is the sigmoid colon, and then in the midline is the aortic and the bladder, okay? So I'm gonna go ahead and listen to the arteries in the abdomen, okay?
Okay.
Okay, so this is the aorta. Okay, this is the renal. The iliac. Okay, and then the femoral. Okay, so I did not know any odd noises or poundingness of the arteries. So I'm gonna go ahead and listen to your bowel movements, okay? The bowel sounds, I'm listening to your bowel sounds.
Okay.
Okay, so your bowel sounds were normal reactive in all 4 quadrants. They were not hypoactive or hyperactive, and I did not know any borborygmus. Borborygmus. Okay, so now I'm gonna do a couple assessments on you. So to start, we're going to test for appendicitis. So can you bring this your right leg up? Okay, and I'm gonna push against you. Okay, do you feel any pain right here?
No.
No? Okay, so that is the ileomuscle test, and that is to test for appendicitis. I'm going to explain how I would assess for ascites, and that is with the fluid shift. So I'd have the patient lie down as you are, and I would percuss down the abdomen, and where it began to get dull, I would mark it. Then I would ask you to lay on your side, and I would again percuss and mark when it begins to get dull again, and then I could measure how much fluid is within the abdominal cavity. Okay.
Okay.
I'm gonna go ahead and palpate on your abdomen. Okay.
Okay.
So tell me if you feel any pain or anything. I'm palpating for tenderness and distension. Okay.
Okay.
Any pain?
No.
No. Okay. What about over here?
No.
No. And over here?
No.
No. And what about over here?
No.
No. Okay, so I'm gonna go ahead and percuss as well. Okay. Okay, so I noted that there's tympany up here, which is normal because as you lay down, gas tends to go towards the top of the GI. And then dullness down here, which is also normal because this is where your stool would be processing, okay?
Okay.
So now I'm going to move on to mobility. Let's do mobility, okay? So if you could sit up for me. Okay, and have you had any recent pain or anything when performing any exercises?
No.
No? Okay, so active range of motion is with you being able to perform it completely on your own without assistance, and then passive range of motion is with assistance. So I'm going to have you do a couple different exercises, and I'm going to be assessing for crepitus, which is like abnormalities and like dysfunction within the joints, okay?
Okay.
Okay, so can you go ahead and stand up for me? Let's get you away from the fan.
Okay.
Okay, so I'm gonna ask you to do as I do, and then I will ask you to do it again, and I will assess for crepitus, okay?
Okay.
So can you arms out like this? Okay, and then above your head, and then behind your head, and back up, to the side of you, and then put your thumbs to your shoulder blades. Okay, do you feel any pain?
No.
No? Okay, and then back out, and then down to your side. Okay, so I'm going to be assessing for crepitus. Can you do that all again? Up, behind your head, up. Ooh. Okay, bring your thumbs to your shoulder blades, back out, and then down. Okay, I did not know any crepitus. I'm going to be assessing your elbow.
Okay.
So can you bend and extend for me? Okay, do you feel any pain?
No.
Can you do that again? And push against me, okay?
Okay.
Ow. Yeah, my wrist pop. Okay, let's do this side. Okay, and go again and I'll push against me. Okay, so now we're going to move on to wrist, okay? So can you bend upwards and downwards? Okay, and can you do supination and pronation? Okay, did you feel any pain when doing that? No? Okay, I'm gonna go ahead and assess for corpus in the fingers. Can you bend your fingers downward? Okay, can you open your hand? Can you touch your thumb to the tips of all of your fingers? Okay, and can you touch your thumb to the base of your pinky? Okay, feel any pain?
No.
Okay, let's go ahead and do this one. Can you bend your wrist downward and upward? Feel any pain? No. Can you do supination and pronation again? Okay, can you bend your fingers downward? Can you separate them? Bring them back together. Okay, can you touch your thumb to the base of your pinky? Okay, do you feel any pain when doing so? Okay, and we're gonna test for motor function, so can you grasp my hands? Okay, so it was even. So now I'm going to assess your knees, okay? So can you bend your knee for me? Okay, do you feel any pain when doing so?
No.
No? Okay, can you do it again? Push against me. Okay. So can you bend your knee for me? Okay, and once more. Push against me. Okay. You can go ahead and sit down for me. Oh, wait. Before you sit down, I'm gonna ask you to extend your legs backwards. Okay. And I would have my patient bend over a table if we had one. Okay, and then can you bend over and touch your toes? Okay, did you feel any pain?
No.
Can you go sideways? Bending sideways? Feel any pain?
No.
Can you twist your shoulders? Feel any pain?
No.
No? Okay, now you can lay down for me. Okay, I'm gonna use this again. Okay, so now I'm going to be assessing your hips and everything, okay?
Okay.
So can you lift your leg straight up? Okay, bring it down. Lift this one straight up. Bring it down. Okay, let's do it one more time and push against me, okay? Okay, and this one. Okay, and then can you bring your knee to your chest? You feel any pain?
No.
Can you bring this knee to your chest? Feel any pain?
No.
Okay, and can we do it once more and push against me? Okay, and once more and push against me. Okay, can you swing your leg laterally out? No, like straight out? Yes, and then back in. And this one. Okay, back in. Okay, and now can you bring your foot to your knee? Okay, and you're gonna go inward and outward. Do you feel any pain?
No.
No. Okay, push against me. Okay, let's switch legs. Inward and outward. Push against me. Okay. So now I'm going to move on to your ankles. Can you see? Yes. Okay. Can you point your toes for me? Okay. Can you point them towards your nose? Can you push your foot inward and then outward? Feel any pain?
No.
No. Okay. Then point and then to your nose and then inward and outward. Okay. Did you feel any pain when doing so?
No.
No? Okay. So can you bend your toes for me? Did you feel any pain?
No.
Okay, and can you do it again and push against me? Okay. Can you do foot pumps, pushing both of your feet at the same time? Okay. Now I'm going to move on to your jaw. I touched your feet, so I don't want to touch your face. Okay. So can you sit up for me for a second? Okay. So can you open your jaw for me? Can you go side to side? Can you protrude your jaw forward? Can you clench your jaw? Okay. Did you feel any pain when doing any of that?
No.
No? Okay, I do not know any crepitus. I'm going to assess your pupil response, okay? So if you could look at me. Okay. Okay, so your pupils were round reactive to a light, and now I'm going to assess for accommodation, and I would rate them at a 3. Okay, so can you look at my pen light? Can you look at the wall behind me? Okay, on this side, look at the pen light, look at the wall behind me. Okay, so there's also accommodation. At this time, I would have my patient go to the weighing station, and I would assess their weight and their height. But since we don't have one, can you tell me your weight and height, please?
250 and 6 foot.
250 and then 6 foot. Okay, so I'll convert your BMI in just 1 second. I'm going to go ahead and ask you to stand up for a second, and we're going to assess your waist circumference. Okay, so I'm going to measure from the top of the iliac crest.
Okay.
And I'm going to measure in inches. Okay, so I would measure, make sure that it's in the right spot. Okay, so I measure 43 inches. Okay. You can go ahead and sit down for me, and I'm going to convert your BMI really quickly. Okay, so your BMI is 33.9. And then, so now I'm going to assess your neuro. So with your gait, I would have assessed with a Snellen chart, but as you were performing your mobility and moving as needed, I assessed your gait, and your gait was appropriate. So for the Snellen chart, I would have the patient stand 20 feet away from the Snellen chart, close one eye, tell me which line they could read, and read it to me, and then switch eyes, and then they could do both eyes at the same time. I would note if there was any hesitancy, leaning forward, squinting, or any misread letters, and I would refer to an ophthalmologist if it was worse than 20/30. Okay, so now I'm going to go ahead and explain what FAST is. So FAST is to determine if a patient has had a stroke or just any abnormalities. So on F stands for face, and you would see some asymmetry, such as drooping in the face. Arms would drift downwards. So can you put your arms out for me? Okay, I do not know any drifting. So S is for speech, so if it was slurred or anything, and then T stands for time. That indicates that it's time to call 911. Okay?
Okay.
So before we finish, do you have any questions?
No.
No? Okay. So I'm just going to show my calculations. Okay. So I'm just going to double check everything. Okay, and so I think that's it. So I would go ahead and document all of my findings, and I would let the doctor know that you're ready. Okay?
Okay.
Here's how do I stop them?